Welcome to Designs for Health. This program is brought to you by Loma Linda University, School of Public Health, the Pacific Public Health Training Center, and courtesy of Loma Linda Broadcasting Network. My name is Renata Kraus. We're here in the studios of LLBN and broadcasting this live. It is also from the campus of Loma Linda University, where students have joined us in the classroom. This is an interactive telecast, and we are very glad to see our students coming in. We have a very interesting program for all of us today entitled Using the Enemy to Increase Physical Activity. Our speaker is preventive care specialist Dr. Ernie Medina. While we're waiting for the rest of the students to join us, I'd like you to meet one of my guests, Dr. Hildemar dos Santos. Dr. dos Santos is one of the professors at the School of Public Health, and his specialty is in preventive care also. Thank you, Dr. dos Santos, for coming and talking with us this morning about a recent trip that you took to Chile. Now, you presented a 3-day seminar in Chile, and it was on childhood obesity. I was just wondering, why would a developing country be concerned about childhood obesity?
Thank you for inviting me. The issue of childhood obesity is not just for Americans, and Chile has a very interesting story because they are passing the nutritional transition. And so they are not having the infectious disease as it was in the past, and they are transitioning to the same disease that we have now, like obesity, diabetes, hypertension, and in the case childhood obesity is a rampant problem.
So, who organized the seminar?
It is the Adventist University of Chile that is somehow connected to Loma Linda, and they invited us.
And so you went to Chile. By the way, you speak Spanish, right?
Yes.
So you
that was one of the main reasons they invited me.
Of course. Aside from the fact that you are a specialist in preventive care. So you spoke with whom? Who was the primary audience there?
Well, the audience was for professionals, and then we have nurses, we have doctors, we have teachers, and other specialists, and also some of the public in the seminar.
And you told me that the seminar also had a very practical element to it. Tell us a little bit about that.
We divide the seminar in theoretical parts where we teach about obesity, and we focus on the family, because childhood obesity is not a problem just with the child. It has to be with the family. You cannot change the child if you don't change the family. Then we did some interaction, and we did some mostly exercise that we can do with the family during the program. So we have theoretical, and we have some games that we play together, that they can also teach their communities to apply that for the families that they will reach.
So games, computer games like what we have here?
No, not really. We are talking about outdoor games with the ball. So we put them in circles. We had to leave the conference room, and then we play around simple games with the ball and different games that we have. But I also, as we are talking about the exergaming today, we also push for those exercise and video games, because they are getting into video games also.
Like the Wii?
Yeah, I went to Chillán is the 4th or 5th city in Chile, and I went to the arcade to see what games they have there, and so they have the DDR, that Ernie will talk later on about that, and they have the jumping jackpot, And so they have numerous games, but 2 are extra gamings in the city. So it's something that they are being open to.
Yeah. You were saying that childhood obesity is a family issue, that the family needs to take care of that. I've been talking with some individuals who have been working with children, with families, and they have said that an adult you can talk with and you can say, you know, you're going to be in risk of diabetes, type 2 diabetes. And these are some of the things that can happen to you. For instance, you can become blind, you can lose limbs, but you can't do that with a child because a child does not relate to that type of conversation. So the family is what you're working with primarily.
Well, the approach is different. The approach with children is to motivate them, is to develop sports and plays and activities that they will enjoy.
Yes.
So if these activities have exercise in those, they will not even perceive that, but they will do.
So if they have fun doing it, they'll do it.
Exactly.
Now, I understand that you feel very strongly about faith-based organizations working in their communities to help them address problems such as these. While you were in Chile, you actually talked with some church leaders, church health leaders in a church congress. Tell us a bit about that, please.
Yeah, I believe that the church can be a center, a community center to reach the population surrounding it. And we have a conference there with health leaders on the weekend after my seminar. And then I talk about nutrition mostly.
Nutrition, exercise, all of that.
Yeah. But I mean, the conference was about all of the lifestyle thing. But what was assigned to me was the nutrition and the importance of eating more fruits and vegetables and to push more this issue in the community.
And is that a problem in the Chilean diet? Do people need to learn to eat more fruits and vegetables?
As they are in the transition, I mean, they have a lot of fruits and vegetables. But if you go to the mall, you see ice cream shops, I mean, 3 in a row beside each other. So they have a lot of junk food there, no doubts about that. So they need a little push to promote a little more on the natural and vegetables and fruits and fiber.
So you were there for the 3-day conference and then for the Congress.
Mm-hmm.
Now, are you doing any follow-up work with the groups now that you're back here in the U.S.?
Well, I am in contact with them by email. But the plan is, this was done in Chillán, a small city. So the plan is to develop another one by the second semester of the year in Santiago, that is the capital of the country.
And you'll be going there for that?
Well, let's see if they
yes,
arrange
if they
for
invite
that.
you.
I'm willing to go.
Mm-hmm. And obviously you can't, it's not very easy to take students overseas with you as you're presenting these. Are students here on campus involved in service learning, doing presentations such as the one that you did in Chile?
Yes, I mean, nationally or in the community here, we always take our students. We have a cancer seminar and then a depression seminar and a diabetes seminar that some of our students are involved on that, doing the presentations by themselves. Also we have health fairs, and that's where I am doing a lot, and the students are running this with their enthusiasm.
Now, one other question, and that is about the wellness center that you've been working at, putting quite a bit of time into, right here on campus. For whom was this wellness center created?
Yeah, for anybody.
For anybody.
For anybody. This is
staff, faculty,
yeah, exactly,
students.
Exactly.
What
anybody.
about community people?
Yeah, I would say mostly the community is open for the community. It's in Dresden Center and is one of the first lifestyle clinic that we can put the name Lifestyle Clinic in Loma Linda. And so we are happy to have that, and it is open for anybody.
So I know that there are several people, well, quite a few people, who will be watching this on the internet and a lot of people watching it on TV. Should these individuals from other places in the world come to Loma Linda for a visit, could they come and tour the facilities? Could they come and be tested, for instance, have a stress test? Are these facilities available free of charge, or do you have a cover charge for
Well, we have
this?
a cover charge, and they should contact Dresden Center, the wellness center in Dresden Center, and they will give all the information that they need for the wellness clinic.
You're a very busy person. Not only are you one of our professors in the preventive care program and the lifestyle medicine program that we just started, but you're also involved in the center, you're going overseas.
I do what I can.
Yes, and that is what the school's focus is, to do what we can to help not only people here within our immediate community, but wherever there is interest in having Loma Linda help. Thank you so much for coming and speaking with us and sharing some of these thoughts.
Thank you for having me here.
Thank you for your time. Now, I believe our student audience in Nickel Hall has convened. Thank you for coming today. I know some of you will need to leave early for your next class, and if that is the case, please feel free to leave when our question and answer period begins. We're sorry that you'll miss some of the questions and answers today, but understand your professor's expectations of you to be on time. And now I'd like to introduce Dr. Ernie Medina, our featured speaker. Dr. Medina is a graduate of Loma Linda University. He's a preventive care specialist in behavior change concerning lifestyle-related diseases. His focus is on exercise, nutrition, stress management, and smoking cessation. Preventive care specialist is a large job description, and he is doing his work at the Beaver Medical Group in Redlands, California. He's also an assistant professor at the School of Public Health at Loma Linda University. I first became acquainted with Dr. Medina when I walked into the Drayson Center, and I saw all of this equipment that was geared just for children in one section of the Drayson Center. Dr. Medina helped to co-found a unique family fitness and wellness center called Exertainment Zone. And this is currently based in the Drayson Center at Loma Linda. The zone features physically interactive video computer games, as well as a variety of family and children-related programs such as Family Fit, Homework Zone, Senior Fit Zone, and others. So this morning, I am just delighted that Dr. Medina is here to tell us just a bit more about what this is all about. He has entitled his talk, "The Enemy," to help us achieve physical fitness. And how do we use this enemy to increase our physical activity? Dr. Medina, thank you for coming. The floor is yours.
Okay. Thank you very much for inviting me here, and it's a privilege to be here and share with you some of the things that I've been working on for the last 10 years or so. And it's my first time to do it in this setting. I've never done any kind of long distance learning, so I was looking at the students over there at 1610, so I hope they're there and they can hear me and see everything okay. So I'm glad to be here. What I'd like to do is I'm going to give a little bit of a background as far as what got me into this, and so we're going to cover some things about who is the enemy that we're actually talking about, and then we're also going to cover how it overcomes a lot of the obstacles that we see in trying to promote physical activity to patients, clients, members, family members, whoever. I'm going to also talk about the research opportunities, because I know there's a lot of students that are watching this, and you know, there are people that are looking for research ideas, and I'd like to try to encourage students, if they haven't settled on any kind of research area, to consider exergaming as a field for research. And then I'm going to talk about some future implications, what's coming in the future, and that kind of thing. So we're going to cover that. But you know, as in the introduction, as you introduced, I've been over at Beaver Medical Group, and for those of you who don't know what Beaver Medical Group is, it's an outpatient clinic. We have about 8 clinic sites along the I-10, so from Colton all the way to Banning, Beaumont. We're out that direction, Highland and all. When I started there, it wasn't very large. Now we have about 170 physicians there. And I work in the health education department. So what I do there is working with our patients who are referred to us for smoking cessation, stress management, like you mentioned. But the biggest thing that I work on is quit smoking, and I mean weight loss. And so in those areas, we use exercise and we use nutrition as ways of trying to get them to, you know, we have to try to motivate them to be more physically active. And so that's how I sort of got into this area, because you know, I always confess when I do these talks, I'm not an exergamer or a video gamer, I should say. I didn't have video games growing up. My parents wouldn't let me have video games as a child, and now that I'm married, my wife won't let me have video games. You know, although I did sneak in an Xbox 360 because I had to convince her I have to do R&D. So that's where I'm coming from. I'm not a video gamer by nature, but I had to learn a lot of these things as I was getting into this field. So I just want to start off with some basic things about weight loss, because this is really what got me started on this path. Some of you have seen some of the statistics that by 2048, they're already predicting that all Americans will be either overweight or obese, and that's very shocking. You know, shocking if the trends continue. Kids are also in dire straits, as far as we know that their weight and the weight trends are going for them for both obesity, overweight, and type 2 diabetes.